Hey, good evening, everyone. My name is Deb Ciamacca, and thank you so much for coming to our People's Town Hall, which we put together so that the people of the 168th District could have a forum to discuss what's been happening in our lives. So first, before we get going here, I know some of you have never done Zoom before, so I just want to talk a little bit about some ground rules. First thing is, please, if you're not one of the panelists, we have 5 panelists that we've already talked to in advance. If you could put your audio on mute, just so that we can hear everyone on the panel. Now, if you do want to talk, what you can do is go into the chat function and you can type in a question or you can type in a comment. And then after the initial portion of this discussion, we are going to handle those questions and comments, and then we may actually open it up to you and say, hey, can you elaborate on this question? Or you may want to comment at that point. So that will probably be after the first half hour of the town hall. Before we get going, does anyone have any questions about what we're doing here, the format, any technical questions about how we're running this thing at all?
And to reiterate, please type these questions instead of unmuting your video.
So I just want to just give a little introduction about what the point of this all is. So first of all, I'll just introduce myself and say, my name is Deb Ciamacca, and I'm running for state representative in the 168th District, which if you don't know where that is, you're talking about Media, Burrow, Upper Providence, Thornbury, Middletown, Chester Heights. I don't want to miss any here. You're also talking about Newtown, Marple 5, Edgemont. I think I got them all there. So this is a big district. It's about 62,000 people. And I'm running for state representative. There's a primary on June 2nd, and the general election is in November. And I have actually been running for this since November of 2018. I got in this race very early because, honestly, I was very disappointed with a lot of the leadership that I saw, not only in Washington, D.C., but in Harrisburg. As a high school government and politics teacher, I teach this stuff every day, and to stand in front of kids and see really poor leadership in so many different ways, I felt it was my obligation to do what I'd always asked my kids to do, which is to get involved rather than be a spectator on the sidelines. So that's why I'm running. It's a bigger story than that, but I don't want to make this about me. I want to talk about the coronavirus and how it's impacted our community. I just saw the numbers before I came here. 58,000 people have died in the United States. And they're now predicting somewhere in the neighborhood of 74,000 people to die in the United States from this. And that's if we maintain social distancing. So obviously, this is the crisis of our lifetime. You know, I often taught about leadership in my government class, and I talked about how leadership can either make leaders or break leaders. And when you look at the great leaders that we had, you know, FDR in World War II, we've had, you know, Washington at the inception of our country, Lincoln looking at the Civil War. We've really had presidents who have risen to the occasion. And unfortunately, right now, I think most of you would agree that Mr. Trump has not really risen to the occasion when it comes to handling this virus. But who has risen to the occasion? It's the people. I have seen so many instances of people, the bottom-up leadership, not only in this district, but around the state and around the country. People are the ones who are picking up the slack, and they have made a big difference. And I think the good thing about that is that I feel that we're starting to reweave this social safety net and also the social bonds between us as individuals. And I think that's really important, because that's another thing I always talked about in my government class, is that, you know, over the last 50 years, I think that we have really we've frayed those bonds, and we've been in many ways more individuals than communities. And honestly, one of the reasons I moved to media from Chester County 6 years ago was that I thought that media was a great community and had people that really we're pulling together for each other. And so I'm proud to be running for this seat because, in my opinion, the best part of being part of this community is that we do look out for each other, and that we do think about the other guy. So why am I doing what I'm doing here? I'm doing it because I've talked to thousands, literally thousands of people, both knocking on doors and making phone calls. And especially since I've started making phone calls the last 6 weeks, I have really heard some unbelievable stories about people who are going through severe trials and tribulations, and people who have stepped up. I've heard stories about unemployed people who can't get their unemployment insurance money from the state. I've heard from people, I heard from a mother whose daughter is a doctor in Philadelphia, and she's worried about her doctor daughter surviving this whole thing, and literally was in tears. I've heard from people who are spending almost every waking moment making masks for people and handing them out for free. I can't tell you how many people I've met who are online who are doing that. I've talked to teachers, and you're going to hear from one tonight, who are teaching from home while they have little kids running around in the background, and they're trying to balance, being a parent and also being a teacher. I've heard from business owners who, are really up against it because their businesses forcefully, not by their own choice, have been closed to benefit the rest of us. And meanwhile, they're on the verge of bankruptcy. And so we have people who selflessly know, these hard times, and are really trying to figure out the best way to get through them. So this is the People's Town Hall. It is about individual people and how they're getting through this coronavirus epidemic. And what I plan to do is to talk to them, introduce you to them, and have them tell you a little bit about their story, and have a little discussion with them. And then once we get through all 5 of these panelists, we'll open it up to the entire town hall and talk a little bit together.
Put the mic on.
So let's see here. So I thought let's do this. I've kind of got a list here of our participants. The first person I want to talk to is Gina. Gina, I'm not sure how exactly how to say your last name.
Schiavello.
Civello?
Schiavello.
Civello. So a fellow Italian.
Yes.
And she was a nurse at Jefferson University Hospital for 31 years. She's lived in media for 20 years. And I asked everyone to provide a fun fact about themselves. I don't know if your husband's going to be upset about this, but she gave her husband a haircut in their front yard, gave him a buzz cut, so that
He broke down.
And I may need that pretty soon myself. So I'm envious that you did that. But Gina, you were a nurse, and so you're looking at this from a medical point of view. How would you say this coronavirus terrible crisis situation has affected you personally?
Personally, it's I can't get enough knowledge about it. I can't. Daily, I'm in the newspaper. I'm in the journals. I'm looking for the trends. I'm flabbergasted by the nature in which this is aggressive to the body. How people in the medical profession have not ever seen anything like this. They've seen the pandemic flu, like it's the Spanish flu in 1918. Of course, we can't compare it in that we had no respirators then, people passed. But this is something that they've made observations with rapidly. And what they've seen is like things like they're standing in front of a patient who has an oxygen, most people know, saturation of 70%, which is really incompatible with life. And they're sitting there talking to a patient, which makes them think maybe this person doesn't need a respirator. They're actually thinking this looks like altitude sickness. When they put them on oxygen, high levels, or put them on a CPAP machine, some of them are actually doing better. This is stuff that they would actually do studies on. They're just rapid firing these things around the world to save people. I see an American Journal of American Medical Association, a call to responses. How can we preserve our personal protective equipment? 250 responses on what we can do to save on them. I see, unfortunately, medical professionals taking their own lives because they've never been in a situation like this. It's not even like a MASH unit where you get a break. There's like 4 or 5 days where it's bad. Then you have a recovery period. This has been 6 weeks of this. 12-hour shifts, sometimes 5 days a week. They have to be family to these people because they can't come in. They're dictating last notes in a cell phone, FaceTiming this, trying to decide who gets a ventilator. My heart is broken for them. I'm not practicing right now, but I guess what it comes down to is what I like to say is that one thing about the mask that people need to understand is that by wearing a mask outside, you're not protecting yourself from others. You are not allowing others to get any disease from you. So that only works if we all wear a mask. If there's one guy in the Wawa not wearing a mask, it doesn't work. If you think of it in those terms, if he's talking, he's contaminating everybody because it's like it's a reverse thing. So I just wanted to bring that out so that it brings it down to what's going on here today.
So you think the biggest thing people are missing is that masks don't really protect themselves, that's protecting everybody else.
Right. And if one guy, he's the weakest link, the guy not wearing the mask. So I think that might be a little motivation for getting the people that say, oh, I'm not going to wear a mask. You're not doing it for you. You're doing it for other people. And when the other people are wearing masks, they're doing it for you. They're giving you that common courtesy.
Let me just ask on a personal level, how has this affected your life? The fact that you are subjected to this.
That what?
How has this affected you personally, being, the fact that you have to stay in the house and shut in all this time?
Well, here's what I do. I cook, I clean, I pray a lot, I read a lot, and I try to contact friends. And it affects me because I think about different people or different immune levels, who's older, who's not, contacting my friends, 2 friends I have that are on the front line, and I contact them a lot to make sure that they're okay. People that are in risk groups, they worry me. I'm very grateful that my family, who goes out a lot more than I do, respect the fact that, limiting their ways when they go out and respecting those boundaries. So that's how it's changed our life. And not as bad as most people, so I'm grateful for it.
Thanks, Gina. Thanks for that medical perspective. We'll get some more from you in a little bit.
No problem.
Let's hear from one of our only student, Max Colizzo. You're a student at Penncrest, correct?
Yeah, I'm a junior at Penncrest.
You're a junior, and you also, I guess you've been affected because you also worked at Scoops, the ice cream place downtown, right? Or are you still working there?
No, well, so it's kind of on pause, so they are doing curbside pickup for the ice cream, but, to kind of limit the amount of people that are in there and, around the ice cream, and the products, it's just the owner and the manager that are doing that, yeah.
So let me ask you this, and this is probably a revelation to a lot of the people who don't have high school kids right now. How are you learning, being that you're a high school junior and you're at home right now?
Yeah, so the transition to online learning was it was bumpy at first, but I think, especially I know we have some teachers here that can speak to that as well. It's been a cooperative effort, I think, between the students, the teachers, and the administration, and we're all working together, and everyone, I think, has been really understanding. So if you have a problem, reaching out to a teacher to get help, and everyone's been very receptive, and just willing to help out each other, whether that be student to faculty or faculty to student. So I think that's been really helpful as well.
How has this affected your social life? Are you still able to communicate with your friends?
Yeah, so I think that's really important, for everyone, is, FaceTime, even just a text or an email to friends and family, is really important to, for your mental health as well, to keep in contact with that kind of people. Yeah.
Okay. This is the beauty of this is the beauty of Zoom. We're getting people in and out, and yes. And next,
Were those daytime or nighttime pajamas? I'm not sure.
Yeah. So Max, you moved in the middle of this also, right? You moved.
Yes, we did. So we were moving into the borough from Middletown Township. Yeah. So that was kind of, very different from anything that I've ever done. I've moved once before as well. And, we were trying to pack up everything that we could that were our personal belongings that we could transport ourselves, because we're moving, 5 minutes away from where we were before. So packing up our cars and driving them over with boxes of our personal belongings, and really trying to have the movers just move the furniture and the stuff that we couldn't physically move ourselves to, limit that exposure. And also living in a new construction house, and still having to have to have contactless work done on the house has also proven to be a challenge. Obviously, getting internet service here while still obviously maintaining social distance and not, having any contact with the person and stuff like that as well.
What's one thing you would like to say to people about how kids your age are being affected by this? Do you think there's something that people are missing when they look at students in high school and how this has affected them?
Yeah, so I think something that has really developed a lot of uncertainty is the transition to college. As a junior, I've started attending, virtual campus tours and virtual information sessions, which obviously, aren't the same. But even for seniors, that a lot of which have already committed to colleges, are thinking about, is it really even worth it for me to go in the fall? Because a lot of them have already said that they're going to be online in the fall. Is it worth it for me to do that, or should I just take a gap year? And so a lot of people are facing that decision as well. Which also goes to the financial viability of some of these institutions as well.
Well, I think you're right. I think this, and I'm sure Dr. Nerz will comment on that, but the idea that students are making the decision about whether to continue their college or to start their college education in the midst of this is really a big decision for them. Well, thanks, Max. I appreciate that. We'll come back to you. And speaking of education, we have Dr. Kevin Nerz here. He's a teacher at Conestoga High School and was my colleague for 19 years at Conestoga. Yep. And he has taught a number of different subjects, AP Art History, every level of German, world history, and I'm sure I'm probably missing many others. But Dr. Nerz, welcome. And what's it like being a teacher, teaching in the midst of a pandemic from your home?
Well, it goes back Thursday, March 12th. That was our last day. And it's been over 6 weeks now. It's incredible when you think about the amount of time, but I, as well as all teachers across the state and across the country, we had to make this change, and like a lot of careers, on a moment's notice. So we had been scheduled to have a staff development day that Monday, the 16th, but things changed so quickly that had to be canceled. So our district administration has done a fantastic and effective job at organizing the staff and getting us to do really the best we can in this situation. And we got right to it. By that following Wednesday, we were delivering online instruction to the students. Most districts, understandably, had taken at least a whole week or week and a half off to get things organized, but we as the staff up at Tredyffrin Easttown got right into it. I have to say, in some ways, online teaching, it's more challenging than the face-to-face. You'll talk to a lot of teachers now. I'm spending more time, and I can quantify it, more time working now than in the traditional face-to-face environment. And I'm not saying that in a way of complaining. I'm just saying that it's a matter of factual way. As educators, we're doing the best we can right now in this situation to keep a viable educational alternative for students. And I think we're being very successful at it.
What would you say the biggest challenge is teaching remotely?
Okay, well, you don't have the face-to-face contact as far as developing the relations. Fortunately, we're late into the year, so students know me, I know them. But just explaining a particular concept, for example, that you would do every day, and just seeing them, and that's mutual, not interacting with your colleagues. I do think it's very important that as educators and all stakeholders, parents, students, when this is all said and done, what are some things that we can learn from this experience and then maybe implement them in the traditional school day? An example off the top of my head would be, and maybe these are things you can work on in Harrisburg, Deb,
Right.
I don't think there's any need to have snow days anymore. Okay, so for example, school districts now, when we have our 2 or 3 inches of snow, which closes schools now, if we're not going to school, we should at least be able to continue the educational program on those snow days by teaching online. So that's something where I could see a change as far as how snow days are.
What do you want parents to know that maybe they don't know about being, the idea of teaching kids online?
Well, I think we are trying our best, okay? And there are challenges, okay? I will say one of the challenges, a very good question. As a teacher, I don't know what's going on the other end as far as a student home life. And that can vary tremendously. It could be a case where a student's family does not have internet, or they do not have a viable computer. Maybe there's 3 or 4 siblings in the household and they only have 1 computer. So trying to have realistic demands when it may not be fair or even across the board for everyone. Also, in the case of students whose family life, unfortunately, may not be as peaceful as another student's family life, that it may just be almost impossible for a student to get any significant sustained time period where they can focus on the computer and get work done. On the other hand, there are households in which, hey, everything is nice, peaceful, under control, very supportive. And I don't know that for each of my individual students and trying to gauge what's best for them.
Do you have any students who are not participating at all?
Very few. I believe right now we're having about a 95% participation rate, which is the figures have been very similar to our typical attendance and absentee rates on a regular day.
Well, thanks, Dr. Nerz. We'll come back to you.
Pleasure. Thank you.
So the next person I want to introduce is a business owner in media, and her name is Joyce Walker. And but she was a teacher before. She was a special education teacher, and she owns Kenny's Flower Shop downtown Media. And so I'd like to welcome Joyce and say thanks for being here. And do you want to talk a little bit about how this awful situation has affected your floral business?
Yes, I came so quickly. We were just getting ready to gear up for Mother's Day and get our orders in, and started listening to the information on the news about this virus and then potential businesses closing. And then just like that, it was in a week, I was closed. That's it. Close the door and close it, lock it. That's it. And so at first I was home. I didn't come in here. I came in maybe once or twice to throw away flowers, and I would come in and, you know, it's very, I'm just in here at 1 year. And so instead of planning my 1 year anniversary, I was planning on how to not go bankrupt,
Oh, geez.
maintain the business. And so, like I said, I was pretty much home figuring things out for a couple of weeks. Our wholesaler was shut down, so I couldn't even get flowers.
Oh, geez.
So, but he actually inspired me. Shout out to Fran at DV Flora, being my inspiration that they were hoping to get up and running and for Mother's Day. And he called a couple of times and said, you know, you can do curbside and non-contact pickup, and we're getting ready to start delivering flowers again. And I got my first, and so he was my inspiration, along with many members of the community and family that have inspired me to just keep on going. And don't give up, reach out for the help. I'm still hoping to get some of that government help to sustain me. But what we did was, I got my butt in here and got my website revamped for online shopping, which we had done for the first time in February, first time for Kenny's ever did that. And so this was the way to go. And so because of that and the help of my daughter and other people who have been pushing the social media, visit media as everybody retags you and the information you put up there, and the phone has been ringing with community support.
Oh, that's terrific.
Just made donations and said send flowers to whoever you want.
Oh, that's so nice.
Yes, I've had quite a few people that I reached out for regulars, and they're like, yes, send flowers, send flowers. And so I'm feeling confident that we're going to keep in business.
Well, one of the things I want to do is everybody buy flowers.
Yay. Well, that was the inspiration, Deb. You know, people said flowers make people happy. That's why you have to do this. It is, I kept saying, it's not life-sustaining necessity. And people were saying to me, it is. And from being in this business full-time for a year, I know that what flower deliveries do, because I do a lot of that myself, whether it's pickup or delivery. And this too, between Friday, and yesterday, I did do quite a few deliveries myself, and people were so happy. They were like, "Oh, thank you!" They were just so thrilled to have something bright and cheery and happy in their home. So, I understand financially, it's a very big. It's not a necessity, but for our mental health.
Yes, yeah.
And it has helped me to be re-inspired what I can bring to other people through my business and to celebrate mothers and families.
Yes.
Looking forward to doing that.
And how besides your business, personally, you're sort of locked in with your daughter. Is it your daughter? And
I am locked in. I'm locked in. My daughter had her second child on April 8th, and I was completely locked into that. And since we started re-upping here, I'm not in complete quarantine now. So we're doing drive-by visits and doing a lot of FaceTime. My son calls from North Carolina every day, and everyone's really been inspiring me. The first couple of weeks were very, very hard. The anxiety is through the roof, and put on a few pounds and those kinds of things. But you just have to really reach out and be inspired by Gina's stories and doctors' good stories. And it's, again, all those inspire me that we can make a difference. Even my own employees were making masks for people in the community and things like that, and they were inspiring me. So you have to fight real hard in there to keep up. But
you're inspiring me, honestly, Joyce. And I'm promising you in the next couple of days, I'm going down there and I'm buying some flowers. So.
Well, thank you. And I just, it really is keeping people connected. That's what I wrote in my notes. It's helping the social bonds. It's keeping people connected. And so I'm sitting side saddle now, and we're going to get that second leg up there to be out and bringing joy to others. And
well, thanks for hanging in there, because I think you're going to be rewarded by that, because you're such an optimist, and and it's contagious. So
well, thank you.
Thanks for what you're doing, really.
Thank you for what you're doing, for bringing.
I appreciate it. Thank you. And last but not least, I want to introduce Luke Kreider. Luke is the co-owner of Manheim Imports auto dealership. And I also have to thank his wife. His wife is a nurse at CHOP. And he has 2 young daughters. And I think he has a bulldog named Dawkins, which I'm guessing it's Brian Dawkins, Luke. Is that right?
Yes, yes, it is. Not to be confused with Daryl Dawkins.
No,
But
Daryl.
No, Darryl, yeah. Yeah, I agree with you. Brian Dawkins is the bigger legend around here, I think.
yes.
But, we talked a few weeks ago, and I think initially your business had really been hurt because the governor shut it down, if I'm not correct, right? By the car dealerships could not sell. But I think that's changed over the last week. Is that right?
That is correct. So he shut us down on March 20th, along with their, a lot of other businesses. We were allowed to open back up last Monday because we do some online registration stuff. So there are still a lot of car dealers that still are not allowed to be open if they use messenger services and stuff like that. So a lot of the smaller dealers are not still selling. But yeah, I reached back out to you. You had called me, I think, probably 3 weeks ago at this point.
Yeah.
And it was around the time when some legislation was going through trying to get car dealers open. Because obviously we could still, we're operating now via online sales, appointment pickups, stuff like that, home deliveries. And that was something that, I felt we could have been doing all along, in a safe and manner. Especially since every surrounding state for us was still able to sell cars, even New York and New Jersey, Maryland, everybody was still selling cars. And I even had first responders. I had doctors. I had a doctor from UPMC that wanted to pick up a car, that needed the car and couldn't. I had some people, service customers, nurses and stuff like that needed to get their car in, that, I was able, but service is allowed to be open. However, if you're operating at 10 to 20%, that isn't always viable.
Yeah, and this is an example of where I think, as someone who wants to go into the state legislature, there's room for compromise. The governor, I think, probably made a mistake with his blanket, closing down auto dealerships. And I agreed with you, and I made some calls. And I'm not saying that what I did, pushed this thing, but
Right.
It's probably happenstance. But I'm very appreciative that he realized the error of his ways. And I'd like to see more of that up in Harrisburg. I think we've seen a lot of, the Republicans in the legislature complaining about the governor and the governor making edicts. And I think we need to have more reaching out, because it's the people who are, are feeling the brunt of this. We've got to reach across the aisle here. And I think we've got to talk to each other. How's your family been holding up, Luke? You've got 2 little kids. They're in quarantine with you guys?
Yes, I have a 2-year-old and a 7-month-old, which for me, it's been great because I'll never have this much time with them. I've been doing what they're easy to get out of the house. Go, if we go for a walk, she knows which way the park is. She'll say park, park, park.
Yeah.
So, that stuff's tough. Like you said, my wife is at CHOP. They went through some struggles in the beginning because their patient load was not that high. So a lot of the CHOP nurses were getting forced to use PTO time, high time, getting canceled 50% of their buddy and gave them back their PTO time.
Oh, that's great. That's really great. Well,
Yeah.
So, I think that's one of the things we've seen from a lot of people, though, is that there, I hate to say there's any good benefit from this, because, it's such a terrible situation. So many people are dying. But I think, a lot of us are looking at this as a time to maybe reflect and slow down. And I know myself, I was pretty much exhausted before I went into quarantine, because I've been knocking on a lot of doors. And so I'm trying to use this time best I can. And I know I've talked to a lot of people who've said that it's a time to really take stock of, us as a family, and us as individuals, and us as a community, and us as a country too. So thanks, Luke. So we've heard from all of our panelists. Maybe actually I'll stop for a second here and ask David if he's gotten any questions or comments that you wanted to bring to the panel or to discuss.
Sure, we've had just a couple. The first one was asked, I guess this is best directed to you, Deb. I keep seeing this, Alyssa mentions, she keeps seeing an ad on Facebook thanking Chris Quinn for his support for first responders. How has he been voting on bills? How has he been legislating?
I mean, the biggest bill that's come up in the last couple of weeks has been the idea of whether to open up the economy or not. And, you know, I just got to say, I'm not really thinking that the way that he voted on that was actually helping first responders, because Democrats were trying to add to the bill PPE equipment for first responders, and the Republicans would not allow any amendments to the bill. So you may have seen I wrote an editorial in this the other day in the Delco Times, and that's part of why I wrote the editorial that I did, which basically means I said, we need leadership up in Harrisburg, not you know, partisan, throwing dirt on each other. And the minimum we can do is allow amendments to bills so that we can have compromise. And so I think by voting, which pretty much was a straight party vote, Republicans voted to open up the economy in many ways, and Democrats tried to have amendments to the bill, and they were not allowed. So I'll just say I've seen daily emails from Mr. Quinn about the number of people who've died in Delaware County. And I know it's tough being a state representative right now because a lot of the leadership has to come from the governor's office. But I would like to see some more actual action by the Republicans to help. And I will say we have some real problems right now. You know, before this thing even happened, our Pennsylvania budget was on the precipice. It wasn't very good. And this is going to throw a major monkey wrench into the Pennsylvania budget for next year. We're not dealing with that right now, but I can imagine there's going to be some really big fights next year because we're really putting a lot of money out there for things like protective equipment for nurses and doctors, first responders. We're even hiring people right now to do contact tracing. You know, Delaware County doesn't have a board of health, but Chester County does. And we're now paying Chester County for our board of health and eventually for contact tracing so we can trace the virus. So that's about the only bill I've seen from Mr. Quinn that relates to that.
So I have a comment that just popped up from an iPhone user. We need to remember this is an equity issue. People of color are suffering at higher rates. So not so much a question, but maybe a good topic of discussion.
Yeah, I mean, I don't know if any of our panelists want to comment about this, but it's horrifying the inequity and the number of deaths that are coming, especially from the African American community, and this has really hit that community hard, and still we don't have testing to help them. And I noticed that now we have private charities taking collections to help African American communities get tested. So any comments by any of our panelists on that?
I actually read something today. There's a county in Georgia where it's predominantly an African American, a lower socioeconomic group. And there's quite a bit. There was a woman who lost 2 family members, and she said that they're going to reopen Georgia, but what are they going to send us? What are they going to do to help us? We're losing people more than other counties. They're not taking anything here, sending anything here to boost us up. So when you look at opening businesses, they're not giving us a fair shake. We're not, she says, I'm not opening my business. I think she had some kind of a food establishment because these people that work for me are my friends. They're people that I live with. Everybody knows everybody in this town. I'm not obligated to open, and I'm not going to open. So that puts that person in a different kind of a frame of mind. People who have less money have less health care. With less health care, they have more morbidities. With more morbidities becomes the increase in the death rate. It's very true. And I don't really know what you can do. It should be a lesson in the future on how to even out the way that we distribute or support healthcare in the country.
Yeah, I mean, I don't know if anyone else wants to comment on that from the panel.
Yeah, and I mean, going off of what Gina said, absolutely. I mean, we have seen, you know, I've been seeing a lot of stuff about the inequity of this, and of course, as someone pointed out in the comments about people of color. And you know, I really hope that our state and our national government, you know, use this as an opportunity in the future, and hopefully in the interim as something to improve upon in our healthcare system and how hospitals are funded, you know, how we educate future doctors, and, you know, a lot of stuff like that that goes into having this inequity.
Yeah, I mean, I think that, Max, you're right. And it really highlights a lot of the issues the Democrats were talking about during the presidential debates. The fact that our healthcare system, you know, really allows for people to be at the mercy of the marketplace. And I'll just say from a personal level, you know, my brother lost his job. He was a chef in Philadelphia for 20 years. At a big hotel there. He lost his job and he lost his health care, and he's 60 years old right now. And so to me, it's hit home personally. Every single person in his family has also lost their job. So you have an entire family that does not have health care and does not have the money to purchase that health care.
Yeah.
And there's something wrong with, in my opinion, there's something wrong with a country that when you lose your job in the midst of a pandemic, you don't have health care. There's something really wrong there.
I agree with that.
Yeah, I think it really highlights the issue that our healthcare shouldn't be tied to our jobs, because I mean, this is the worst time for people to be losing their access to healthcare, and it really highlights the need for some kind of, you know, public healthcare. Yeah,
Absolutely.
absolutely.
Yes. And, you know, I've said that I you know, I kind of, I'm not saying that I'm for the Medicare for all per se, but I wanted a buy-in option so that anyone could buy into that. If they liked their own health insurance, they could buy into, and someone else wanted to buy into the health insurance, that they could do that. But I think what we're going to see next year, once we're past this, we're going to see a major nationwide discussion. And I think this is a paradigm shift, because people are seeing what not having healthcare does to the rest of us, in a selfish way, to the rest of us when we have an epidemic like this. So, David, did you have any other questions or comments that from people?
Yeah, actually, so the person who asked that initial question or made that initial comment is actually our dear friend Danielle. So thanks, Danielle, so I have 2 points about this. She has a couple. She actually has a direct question for you, Deb, and it brings up to my attention that you should all feel free to use the chat box to converse amongst yourselves too. I mean,
Yes.
we'd love to stimulate a discussion here. Specifically, Danielle asked what your plans in Harrisburg to begin to remedy our equity issues, particularly where funding education is concerned.
Well, I mean, this has been one of my biggest issues as a teacher. And one of the first things I saw was that when we went online, because teachers had to teach virtually, there are school districts right near here, like Chester, that I talked to a charter school teacher there, where they did not have any technology to be able to teach the kids there. And because they didn't have technology, not only did they lose the ability to have education, but a lot of the kids who had special needs and needed special education help because they didn't have the basic regular education, they were not required to fulfill the IEP needs. So here you have kids who are already behind, who need additional help, who are getting absolutely no education and nothing. And so, you know, one thing that this coronavirus has done is it has ripped the scab off the inequities that we have in society, whether it be education or healthcare, and in so many other ways, things like minimum wage. And so, you know, what I'm hoping is that a lot of people who were on the fence on these issues and saw them as, quote, socialism, you know, will see that it's not socialism. It's fairness and it's equity. And, you know, for example, one of the things that I had advocated for was a severance tax on the gas that's being pumped, you know, by the gas industry in Pennsylvania. We literally are the biggest state that does not have a severance tax. And Republicans have fought this for years. So we are throwing away over $1 billion a year that we could be using for education and healthcare. And I am telling you, next year, we're going to need this money because we're going to be in a severe economic crisis in Pennsylvania. And the government's going to be looking in two ways to rectify that. Do we cut jobs? Like, for example, do we cut teachers again, like we did in 2010? Which, or do we raise taxes, which is, you know, anathema to Republicans? There's no, right now the budget's put together with bubble gum and you know, and rubber bands. And so it needs a structural fix to remedy these big issues. And it can't just always be cutting teachers and policemen and firemen to rectify this situation.
Seems to me, Deb, that these areas are the first budgetary cuts that come through every time there's a crunch. You know, we're going to cut education, we're going to cut policemen, firemen, and those that directly serve our community. And that's where sometimes I say, you know, fair is not always equal. Sometimes we need to have fairness for everybody and not cut where we need it the most. Direct service.
But, you know, just putting this out there in a political realm, I just got to say, we have not had a Democratic House of Representatives in Pennsylvania in 20 years.
Yeah.
And we need 9 seats to flip. And one of those seats is this one. And mine's been rated the most likely to flip in Pennsylvania. And so that's why I need people to come out, because next year, people are going to be sorry. I hate to say this. If we have a Republican legislature for another 2 years, the number one thing they're going to do is cut. They're going to slash. They're not going to cut. They're going to slash this budget. And so many should be worried. And that's why I know it's hard to campaign in a virtual sense, but you know, this is why I need your support. I'm not doing this for me. I'm doing this for teachers and educators and students and people without health care. These people need help. And we need to stand up for what's right. And what's been going on in this state has not been right. And one instance of it is Oklahoma and Texas have a severance tax on gas, and Pennsylvania does not.
Nope.
Right? So how can you throw $1 billion away a year? How? It's not right.
I have a nephew, it's my niece's baby, he's not a baby, he's 6, who has speech therapy. And he hasn't been getting it for as long as the school has been closed. He's been getting his education. I went to see him because I know he's been in strict quarantine, so it was 3 or 4 weeks. So I missed him, I went to see him. I could not understand him as well as I could 2 months ago. It was sad. His mom had to tell me some of the things that he was saying.
And this is one of the things where I just heard, I don't know if you've heard that the governor of California was talking about possibly starting California schools in July, just because so many people have, they're losing the educational gains that they made during the year. And as Kevin Nerz said, you know, you can do so much virtually, but you cannot replace the individual help that one person can give to, one teacher can give to another. And, and also a lot of these kids they need social relationships too. I'm sure Max misses his friends, and this isolation is not good for anyone's mental health, and especially our kids. David, did you have any other questions or comments that you saw that were interesting? Or
Yes, indeed. And I also just want to mention to Luke, who is muted right now, send me a message if you'd like to be unmuted. You're the only panelist who has manually muted yourself. We'd love to have you in if you want to contribute. Question from Gary. What type of service activities are there for folks in our district? For example, resident-to-resident ones like mask making, check-ins on older folks, or perhaps a blood donation, as you're about to do, Deb.
Yeah, I was just saying the other day, I know it's very frustrating for people because I know a lot of people want to do something to help the community. One thing I'm doing is I'm giving blood through the American Red Cross. You can go onto their website and you can find local blood donation sites, and they're doing that with, you bring your mask, they're doing it one person at a time, and they're desperate for blood. Because people stopped giving blood because they thought this was a risk to their own health. In media, the media food bank, I went down there the other day to see what they're doing, and they need help organizing the food bank. I know, Max, your parents help down there at the food bank. Do you want to talk about that at all, like about what media food bank's doing and all?
Yeah, so unfortunately, we haven't been able to participate because my mom and my stepfather are both immunocompromised. So that has kind of been very limiting for us as well.
Yeah.
So we haven't actually been able, but we have been in contact with them, and we do know that they are definitely in need of some help. I know that a lot of people from the Penncrest community were setting up donations for them. But yeah, so if you guys want to donate food, or if you want to donate your time, I know that they would definitely be appreciative of that as well. And they're always looking for volunteers, especially now.
And if you can't volunteer because you feel you're either immunocompromised or you just feel you're in that age group and you can't do it, they will take cash donations, and they appreciate the money and they need the money. This weekend, Jen O'Mara, the representative right next door to us, is doing an actual food drive in Springfield. I'll be posting that on my website on my Facebook page, so you can donate food there. And so I know a lot of what I'm seeing is spontaneous. I know many people who are just making masks. One of the Democratic committee people up in Marple Newtown has made 1,000 masks and organized that within her community. So those are the ones I know. What I'll do, Gary, is I'll post a list of things that people can do if they want to participate.
I did see on, I think it's delco.gov, there's tons and tons and tons, page after page after page of links of information as well. I think there was a Delaware County Volunteer Corps, and I didn't even click on it. I just happened to look at it. And it was a plethora of information, but there might be something in there that somebody could do that they could jump onto and at least, avail themselves of something, because I think everybody really feels like they want to do something. They just don't know what to do.
I'll post that. That's a great idea. So I'll post that on our Facebook page, so you can people can take a look at that and make a decision on their own. So thank you for that, Gina. Anyone, any other questions you see there, David?
Yes. So Jody asks, wondering if you, Deb, have any updates about the work on the pipeline and how the virus is affecting it right now.
Well, this is a very controversial, aspect of our community. As you know, the Mariner East Pipeline goes through this district, and they have continued construction and have applied for waivers over and over again to get around the construction, bans that were part of the governor's edict. And right now, in fact, I was talking to Eric Friedman, or I got a text from him or an email from him yesterday, and I thought they had actually stopped, but they're appealing again. And so, this is an area of big concern for me. And actually, it's such a big concern that in a couple of weeks, we're going to have one of these town halls on nothing but the pipeline. And we're going to give everyone an update on what's going on with the pipeline, because there are people who are very concerned. There are residents who live right next to the pipeline, and there's no social distancing going on, and the construction. Actually, they're worried about the workers on the pipeline being forced to work in an environment where they can't social distance. So I'm investigating this right now. I am concerned for the safety of the residents, for the safety of the construction workers, and I will give you a more complete update in the very near future.
All right, I'd like to mention that we've got about 4 minutes till 8 o'clock. So if you'd like to start making some closing remarks, now would be a good time.
So, I just want to say, first of all, thank you to everyone who has tuned in tonight, and to our panelists. The whole idea behind this was, I felt so called to do this because in all the phone calls that I'm making, I'm hearing the pain, not just the pain, but also the joy of people who are reaching out to their neighbors and coming together and making things better for them. And, as a state representative, what I want to do is to do this for the rest of the time, hopefully that you elect me, and the rest of the time up in Harrisburg, is that a representative should be a representative of the people. And so you can't 100% make everyone happy, but what you can always do is you can listen, you can tell the truth, and you can be transparent. And what I hope to do as a state representative is to be the vehicle for the voice for people, the voice of people who don't have a voice. And I feel like right now, the people are the ones who are the leaders in the country. We are the leaders in the community. And, doggone it, if the president's not going to lead, then the people will lead. And I'm so proud to be part of this community. And, who knew when I started running back in November of 2018 that I was going to run up against a pandemic in the middle of this campaign. But what I've realized is this is so much bigger than me. I'm just a very small part of what's going on here. But if I can change things in any way for the better, if my vote is just a vote to give people a voice up in Harrisburg, then I will have done the right thing here, because I quit my job as a teacher, a job that I loved, because I knew that we had inequity and pain in our society, and it's only been exacerbated by this terrible, terrible crisis. So what I ask of you is, please keep me updated. If you see someone who needs help, please tell me about that. I will track down help if I can get them help. If you see injustice or you see things that need to be changed, please let me know. That's what I'm trying to do here. And I appreciate you taking the time and making the effort here. And I thank you very much.
We thank
you, Deb.
Thank you.
Thanks to all the panelists. Thank you all for joining us.
Thank you. Take care and have a great night. We will be posting this eventually online, right, David?
Yes.
Thank you,
Facebook
everybody.
page.
Take care. I salute you.
Bye-bye.
Bye-bye, everyone. Take care.
I thank you.
Take care.